Dry eye can have a range of severity, from mild through to moderate, right the way through to severe dry eye. My opinion is that mild and moderate can be managed easily in pharmacy with the use of topical lubricants and liposomal sprays. However, if you feel that you have a patient who has severe dry eye, or if you feel that you have a patient who's got mild or moderate dry eye that you're uncomfortable with treating, I would always work in conjunction with other healthcare professionals, like your doctor, your GP, or an eye care practitioner. So with the treatment of dry eye, I have to bear in mind that 80% of the patients that I'm going to see who have dry eyes will be suffering from evaporative dry eye. As an eye care practitioner, I want to treat the cause of this dry eye. And that's going to be related primarily with the health of their eyelids. Treatment will revolve around cleaning their eyelids using special wipes to get their lid hygiene good, and then applying heat to their eyelids to actually raise the temperature of the oils in their eyelids, and then massaging their eyelids to express out any congealed oils. So ultimately, we want to get to a point where when that patient blinks, they're going to express an oily oil into their eyes, not a sort of creamy discharge into their eyes. If I'm brutally honest, this requires my patients to be very, very compliant. They have to do this day and night for a month, and then once a day for the next month, and then 2 or 3 times a week ongoing. Realistically, very few patients actually follow that regimen. And what will happen is they'll start off, they'll do well, and then as their symptoms improve, they'll give up because they're not suffering as much. Then the symptoms come back with even more severity. So I have to look at other solutions to offer my patients. An alternative treatment strategy is to actually give my patient tear supplements. So that's topical lubricants that they can put into their eyes to give them instant relief of the symptoms that they're actually experiencing, and then to supplement that with liposomal sprays like Optrex Actimist, which will give a biocompatible substitute for the oils that would normally be produced by your eyelids, thereby replenishing that lipid layer every time the patient blinks. Liposomal sprays are a real asset in the treatment and management of patients with dry eyes. What we're offering our patients is a biocompatible way of mimicking what nature does in terms of replenishing their lipid layer on their tear film. In essence, 3-4 times a day, a patient can spray the liposomal spray onto their closed eye. The oils will run down their eyelids and gather at the edge of their eyelids. And every time that patient blinks, those oils will spread over the tear film, thereby reducing the level of evaporation of the tear film, thereby actually giving them less symptoms and helping them resolve their dry eye condition. In day-to-day pharmacy, I believe there are lots of opportunities where general life coaching with our patients can be of great benefit. So if you actually understand what your patient's lifestyle is like, what their environments are, that they work in, that they socialize in, what their lifestyle habits are, how often do they go out, how well do they sleep, you can actually help them to manage their eye condition, their dry eye condition, much, much more effectively by giving them good advice. Simple things like making sure that they have a good diet, that they stay well hydrated. Think about their use of alcohol, how much, how frequently. All of these things will impact on your eyes. So simple lifestyle coaching will actually help you help your patient to get on with things more effectively.